All right, I'll get it started. Hey everybody, my name's Alex. I'm based at Tufts University, supporting the A&H Academy Research Communities Project, along with Nola, Will, and Chaylin on the call. I'm really glad we have you all here with us today. I'm super excited for this session. Joyce's research is super interesting, and I'm glad we can have more connections between A&H Academy and UNAR in Malawi, which is where we had A&H Academy Week in 2023. So I see a few familiar faces and names who joined us today, but I think there's some new people here as well, which is fantastic. So before we turn it over to Joyce, I'll give a brief introduction to research communities um, and sort of explain, why we're here, what we're doing, and how you can be involved. So in the meantime, if you have enough bandwidth on your internet, I invite you to turn on your camera so we can see who is here. And I invite you to say hello in the chat box. You can just say your name, what country you're calling in from, and where you work as well. It's just helpful for Joyce and I and everybody on the call to just know who's here, so we can have a richer discussion, towards the end of the call. So for those of you who are new to research communities, I'll share a bit of background. The Research Communities program is designed to give A&H Academy members focused on a particular topic, a space to share their research and learn from each other. So we have calls like this once or twice a month, where a community member like Joyce can share what they're doing and learn from you all. And we find that people join from many countries, working in many disciplines and many fields, but all related to food access. This community is the food access and demand for healthy diets research community. And I'd be remiss if I didn't mention we just launched a new research community focused on food supply, loss, and waste. So now we're covering sort of all aspects of the food system in these groups. And members like you are encouraged to share your work if you're interested, and you'll see what that looks like when Joyce presents. But our past presenters have shared their experiences and research from many different countries, Ghana, Nigeria, Pakistan, Uganda, Vietnam, and more, as well as at the global level of analysis. And we really do invite people to share from sort of all stages of careers and in the research cycle. So emerging findings are great, published papers are great, and anywhere in between is welcome. So I'll share some information in the chat if you'd like to present at a future event or write a blog about your work or just learn more about what we do. That reaches directly to me and Nola, and we'll be able to help you get involved. So today's presentation will feature Joyce Minofu's research looking at the prices of healthy food and diet costs across 10 countries in Africa. We're really excited to have Joyce here presenting. And without further ado, I'll turn it over to her to discuss her work. So thanks, Joyce.
Thank you so much, Alex, for that warm welcome. Let me right away share my screen. I hope we are all able to see the presentation. All right, so yes, as Alex put it, this is research work on food access, and it's part of my academic research at the University of Agriculture and Natural Resources. And I also currently work with Mwapata Institute, a local agricultural policy think tank in Malawi, as a research analyst. So going straight to today's presentation, I'm presenting on a topic: healthy foods cost more and differ by region in sub-Saharan Africa. It's a systematic review and meta-analysis study. So as the presentation layout, I'll start sharing the study motivation, and then I'll go into the data and research methods used, key findings of the study, and also I'll share the policy recommendations being driven from the outcomes of the study. Food access is a fundamental human right. However, adequate to safe and nutritious food remain persistent out of reach for millions of people, mainly because of prohibitive food costs. Worldwide, cost of a healthy diet ranges between $3.27 to $4.57 per day. As a result, over 300 billion people worldwide are unable to afford minimum dietary requirement. And this condition is driving undernutrition and poor health outcomes in the world. The affordability challenge is so serious and acute in low-income countries such as Southern Asia and Sub-Saharan Africa. And nutrition deprivation is one of the major challenges in these regions. There have been progress in reducing hunger in Sub-Saharan Africa, but the progress itself does not significantly translate into nutritional quality improvements. Yes, we have witnessed improvements in the caloric intake levels, but when we look at the other end, dietary quality, it remains low in Sub-Saharan Africa. We still witness diets in Sub-Saharan Africa being dominated by starchy staples. In Malawi, for example, sima, and the energy-dense food, nutrient-poor foods, whilst nutrient-rich foods, such as animal source foods, fruits, vegetables, their index is very low. And when we go into the literature, we check that FAO projected that in Sub-Saharan Africa, the intake of animal source food is going to reach only 30 grams per person per day by 2050. And if we compare this to global dietary reference diets such Eat, Lancet, this is far below these global dietary models. So there is persistent gap really in the quality of diets in Sub-Saharan Africa. And this persistent gap underscores the urgent need for us to provide evidence, more specifically to understand and address the barriers to accessing diverse and nutrient-rich food in Sub-Saharan Africa. Amongst the main determinants of access to quality diets, cost emerges as a central determinant in Sub-Saharan Africa. Despite this evidence, there is no study on systematic review to provide that evidence on actual cost of healthy diet, which remains limited and fragmented as evidence. So this study is the one, is like first systematic review according to our knowledge, and a meta-analysis that is looking at cost of healthy diets in Sub-Saharan Africa. We managed to synthesize about 146 standard costs, food costs that's across 10 countries in Sub-Saharan Africa. Specifically, we assessed how affordability varies by food group and countries, and also how it's shaped by macroeconomic factors. Thereby, we established a policy, establishing policy relevant baseline on improving food access. Yes, we acknowledge that earlier studies have been conducted on the same, but these studies have demonstrated a broader pattern. That's like they are at global level. They have provided limited insight into drivers within Sub-Saharan Africa. So by adding knowledge to the global study that have been done already, we try to test two hypotheses in this study. The first one being that nutrient-dense foods, such as animal source foods, vegetables, are more costly per kilocalorie than the starchy staples that are common in Sub-Saharan Africa. The second hypothesis that we try to test is that variation in food cost estimates is independent of study attributes such as data characteristics, and also country level characteristics such as maybe GDP income levels of the country. Now, coming to data and methods, we followed PRISMA through all the processes of research, design, implementation, and reporting PRISMA framework is preferred reporting items of systematic reviews and meta-analysis. So it's a framework for conducting systematic reviews and meta-analysis. So we followed that throughout the processes of the research, design, implementation, and reporting. And we did our search in the Web of Science in January this year. We only use Web of Science. It being a universal database, we chose only Web of Science for main reason is for replicability of the results so that other researchers can do the same or maybe find the same results. So before we designed our search query, we also did a scoping review, whereby we reviewed 5 papers to guide how we design our search query so that we are able to attract or get the papers that will answer our research question. So those 5 papers were, scoping review was done on them, and then we designed our search query as cost of healthy diets or cost of nutritious food in Africa. Through this query, we managed to identify 1,692 studies through Web of Science. And all these studies were subjected to screening process. And what you see there is a chart showing how we did the selection process, the screening, eligibility, and even the inclusion, where we finally put our papers to do the analysis. So the first screening process was on the title. So all the 1,692 papers were subjected to title screening. And from that screening process, 1,517 papers were excluded, based on different issues. Some of the issues include some of the papers in the title, it was exclusively saying, explicitly showing that it was not done in African country, it was done in an African country. So we had to exclude because our target is African country. And some papers in the title was clearly showing that it's about animal nutrition. So for us, it's human nutrition, so we had to drop those. And also in some cases, the papers were to do with a specific group of people that have special medical conditions, like diabetic patients. Some was to do with people with cancer, some was to do with athletes. So for us, we wanted to analyze costs on the health and general public as stipulated when doing the national dietary guidelines. So that's the target. So from all those reasons, that's made us drop 1,517 papers. So we remained with 175 papers that underwent abstract screening. On abstract screening, we also dropped about 104 papers for the reasons shown on the chart. Some are from non-African countries, some were on food production. For us, it's on food access, so there were no price data in the papers, and so forth and so on. And then on eligibility, we did also screening. We remained with 35 papers that underwent food text studies assessment. So from the 35 papers, 28 were excluded for the reasons shown on the chart. And at the end, we remained with 7 papers that we are now eligible to do meta regression and systematic review. Now, when we extracted the cost estimates, the first stage was to standardize those because some were presented in kgs, some in grams. So we had to standardize to single unit cost per 100 kilocalorie. So we did this using reference index ranges from Lancet being our reference, global reference recommendation diet. And also we did an adjustment of the figures of the cost to adjust for inflation to reflect 2019 price levels. So the conversion rates were gotten from our development indicators for each and every country that we analyzed. And also we got some supplementary country level variables to help explain the variations in the food costs. So the additional variables are GDP per capita, urbanization level, and geographical regions, which were all gotten from World Development Indicator. So we further did meta regression itself, and we conducted meta regression analysis on 5 main food groups that had adequate data to do a statistical analysis. So we had starchy staples, meat, fish, pulses, vegetables, and fats. But due to limited data, we couldn't run regression models for dairy, added sugar, fruits, yes, those 3 food groups. So as a meta regression, in simple terms, the model is shown as costs being influenced by study level attributes and also the country level attributes. So X here is the study level attributes. So X here is the study level attribute, and Y or Y is the country level attributes, and this is the error term. So depending on the assumptions we make on the cost estimates we have extracted, one can use random effects model in learning the meta regression, or one can use common effect model or fixed effect model. So for us, we chose random effect model over common effect model and fixed effect model because random effect model assumes that the set studies represent just a sample of a population of studies, while common effect model assumes it's a broad assumption that all the food groups or food group costs that we have extracted are the same and equal to the true costs. So this is usually not practical unless the papers are the exact replicates. But in our case, this is not true. We got the studies from different countries and by different authors. They're not exact replicates. Again, on the fixed effect model, it assumes that the estimates that we've gotten represent the entire population of interest. So to us, this is not true, as we only got 7 papers and 146 cost estimates. So there are some serious challenges that one needs to look into when doing meta regression, such as heterogeneity and publication bias. For this tool, we did some tests and the results will be shared in due course. Now, coming to our key findings, as I elaborated, we synthesized 146 cost estimates from 10 African countries. However, when we look at the contributions of the cost estimates by each and every country that we analyzed, you see Tanzania has largest entries, highest entries with 33%, seconded by Malawi. However, we managed to get data also from Mali, Nigeria, Senegal, Burkina Faso, representing the Western region, African countries, South Africa and Malawi, representing Southern Africa region, while Tanzania, Ethiopia, Uganda, and Kenya representing the Eastern region of Africa. We did not find any cost estimate entries for countries from Central Africa in our analysis. Again, when describing our data, we found that most of the data that is used in the papers we extracted, these are peer-reviewed papers, most of the data was collected between 2014 and 2019. About 69% of the data was collected between this time period. And we saw a serious drop in the cost of food estimates in 2020, 2021. So this poses serious problem when it comes to considering current evidence on food access. Again, on characteristics of data we worked on, we also found out that most of the data that was used in these papers was on cross-section, like 50% was on cross-section, with about only 17% time series data. So this also limits the access, understanding of the food access in terms of the dynamics of affordability. So you cannot find variations with over time because data on time series is limited. Now, when we came to sources of data, we found that most of the sources that these papers use is from secondary data sources, not primary data sources. So this is also why some things means whatever decisions we're making on food access is based on the data that was collected for other objectives and other reasons, and we are using that. Of course, we find important elements to connect to provide evidence, but it shows that we are not doing a lot in generating evidence for informed food access. On the nature of data, we also found something that most of the data that these papers use is from household surveys. Not market studies were only 30% of the data. So these are some of the things about the food access data in sub-Saharan Africa. Now coming to meta-regression results. Our results on meta-regression, as I said, we learn on each and every food group. And first, these forest spots were done on all food groups, just to do the understanding of the food costs based on the papers that we analyzed. So from the results, we see that vegetables have the highest average cost per 100 kilocalorie of 60 cents per 100 kilocalorie, seconded by meat and fish, which are going at 43 cents per 100 kilocalories. Pulses, starch, and fats are more affordable, or going at less than a cent on per 100 kilocalorie. So this just confirms the general understanding that nutrient-dense foods are less affordable. And this be the reason why we have low data diversity in sub-Saharan Africa, because people don't have that money to go for nutrient-rich foods. But now when we go to specific food groups and looking at heterogeneity, we observe that there are high heterogeneity levels. This is for starch staples. Going to meat and fish, it's even very high, 97. For vegetables, it's up to 98. For pulses, it's 92, close to 93, and here, of course, about 80. So this just shows that there are also between study variation on the cost estimates. So that this hesitated us to do further analysis, to do the meta-regression, to understand some of the factors that could influence changes in these costs. So here I present the meta-regression results that we did on the 5 food groups, but here I only present 4, because vegetables had no significant variables, so it's not part of this table. So when we come to starch staples, for example, we see that starch staples, cost of starch staples, papers that used the most recent data reported significantly lower costs of such staples, and even those papers that used household data as compared to market data reported significantly low values of such staples. And when we look at the geographical factors and even income level, macroeconomic factors, we see they do not significantly influence such staples. This is somehow explaining the fact that such staples are basic food. Every country, regardless of whether of their economic status and geographical location, aim to have in their country basic food. And even agricultural prices are all leaning towards having fighting hunger, as I already explained. So these do not have a significant effect on this, because most countries are full self-sufficient when it comes to starch staples. However, the story is different when we look at healthier foods like meat and fish. In our case, we see that geographical location plays a significant role in the prices of meat and fish. For example, countries coming from Eastern African region reported significantly lower costs for meat and fish when compared to countries coming from the Western region of Africa. Interestingly, countries coming from the southern region of Africa, so Malawi, South Africa, and other countries, reported significantly higher costs for meat and fish when compared to West Africa. So geographically, if we are to rank meat and fish costs, we say they are most expensive in the southern region of Africa, seconded by West, and then they are least cost in the eastern region of Africa. And when we look at the level of urbanization, we see that countries with higher levels of urbanization reported significantly lower costs for fish and meat. Whilst when we look at the data issues or between study changes, we see the attributes. We see that studies that used 2014 to 2017 data sets collected in data sets that were collected in 2014, 2017, and those that used in an cross-section data such as time series and panel, they reported significantly higher costs for fish and meat. Coming to pulses, we see that geographical location plays a very significant role, whereby countries from Eastern region registered significantly lower costs for pulses, and also significantly lower costs for added fats. On the added facts, again, we see that countries with higher urbanization levels also reported significantly lower costs for added fats, whilst countries with high income levels reported significantly higher costs for added fats. So in a nutshell, what we see here is that affordability issues are not uniform. They differ by different factors that we have explained. But another thing that is of interest on these results is how our EGAS test for publication bias came out. This shows that we don't have publication bias. So there's no selective reporting in these cost estimates. So they can be generalized and inform the policy decisions. Now, going to policy recommendations driven from these results. Firstly, is that there's a need to align global dietary targets with regional nutritional gaps. Global dietary targets such as Eat Lancet, for example, they rightly emphasize sustainability and public health. But the assumption is that the baseline diet is high meat and processed food consumption. So the departure point is this population is consuming more meat and is consuming processed food. But this is not the case with Sub-Saharan Africa. In Sub-Saharan Africa, we have seen diets are overwhelmingly plant-based. Because plant-based diets, food is cheap. We talk of starchy staples, pulses, we have seen their least cost products. So because of poverty, these are easily accessible to people in Sub-Saharan Africa. So if we do strict application of the global dietary guidelines, we could entrench the deficiencies. Because in Eat Lancet, somehow there's meat avoidance. But in Sub-Saharan Africa, moderate consumption of meat would go a long way in improving nutrient intake, especially in children and women. So Sub-Saharan Africa policies should focus rather on expanding food access by supporting diverse, affordable, and locally acceptable sources of essential nutrients. Another policy direction that we have derived from the results is that there's a need to realign agricultural policy toward nutrition sensitive outcomes. What is happening in Sub-Saharan kind of a paradox, because in Sub-Saharan Africa, we are capable of producing adequate food. We have the resources, all it takes to produce adequate food. We have land, labor, even agroecological capacity to grow varieties of food and even lay animals to a scale. But we say healthy foods are inaccessible to millions. What is lacking is the limited development of diversified food supply chains. Our agricultural policy in particular bias towards cereals and export crops. And we have underinvestment in agro-processing because we observe that during harvest time, we have plenty wasting sometimes some of the produce. But during lean seasons, we look lacking as we never produce something. So this is serious. And what needs to be done in Sub-Saharan Africa, I think, to unlock its potential by supporting agro diversification and even improving production through increasing productivity and strengthening the institutions that connect the producers, the farmers, to the markets. Another policy guidance is to build seasonal food cost dashboards and early warning monitoring systems. So we have seen that only 17% of the data that we have analyzed is on seasonally disaggregated data. The rest is about 50% is on cross-section. So this limits the type of analysis that we can do on food access. It denies us ability to do temporal dimension of affordability, to understand the temporal dimension of affordability. There is critical evidence gap on this. So despite this, we know it's well documented that seasonal variation has an effect on food access. So, the issues of rain seasons, I just gave example of harvest cycles, and even climate-related shocks, they all move with time. So we need to have evidence to be able to inform policy. So seasonal data indeed is important because it improves research sensitivity and even policy responsiveness to changes over time. Another policy recommendation is that there's need to support new research and update food cost databases. You know, I explained, I think I did not explain this one, but when we were looking at the data costs on food costs, we wanted to do the analysis up to 2024, but unfortunately we couldn't find a study that used data beyond 2021. So we were limited to analyze data up to 2021, but our analysis, we managed to get data, we managed to get studies up to the entire year of 2024, because we did the identification in January this year. So this kind of limiting our understanding of affordability in current context, because the latest data that we have is 2021, and a lot has happened in between, you know, pandemics, trade changes, and several restrictions in Africa, but we couldn't explain that in terms of affordability because of the reviewed studies that we retrieved through peer review. We couldn't, none of the papers used the most recent data. So this is not just an academic concern to say, no, we are not adding to the board of literature, but it's not only about adding the board of literature. Yes, it's important, but it is also on the policy arena, leaving policy responses misaligned to rapidly changing cost environments. So this is a concern. So supporting new research is going to go a long way in capturing emerging trends that will inform effective response. Last but not the least, policy recommendation is a need to build robust national and subnational cost tracking system. In our meta regression results, it was clear that regional disparities are there in affordability, and that affordability challenges are not uniform. Okay, so the disparities are reflecting a number of factors, a combination of factors. There are structural factors, behavioral factors, and cultural factors. For example, agroecological advantages of these countries and even the regions are not the same. The infrastructure quality, the trade integration itself, even consumption preferences, which are linked to cash issues, they are not the same. So there's need to build that robust national and subnational tracking system where we are able now to account for these contextual factors to be able to explain the informed policy rightly. Reaching that far, that's the end of the presentation. But before I hand over, allow me to acknowledge the co-authors of this research output, Professor Limbikani Matumba, from Food Plus Research Group, Faculty of Life Sciences, Natural Resources, is one of the supervisors from Lungo University of Agriculture and Natural Resources, Associate Professor Beston Maunga, Department of Agriculture and Applied Economics, again from Rwanda, Lungo University of Agriculture and Natural Resources, and then Dr. Horace Piri, who is the head of the Department of Agriculture and Applied Economics from Rwanda as well. Thank you so much.
Wonderful. Thanks so much, Joyce. That was really interesting. And I'm glad we have, 25 minutes or so for questions from people here who are, I'm looking in the chat from all over, but many in Malawi. So if anyone has a question for Joyce or a comment or something to share, you can please do so now. And then if not, I have some questions for Joyce too, because I found that super interesting. And you can share with your microphone or in the chat. Both are very fine.
So if others don't want to go first, I can start with one question about your interesting observation regarding household prices versus market prices. And that relates also to the question of whether you're looking at the least expensive options that would determine access, in contrast to the average prices that depend on many factors. So when we get a household price, that's usually from asking people what is the total they spent and what is the total quantity they obtained. And So total spending divided by total quantity is the average price, not any one item's price in the marketplace, but rather the average of what they actually obtained. So those are called unit values. The average unit value is often quite different from if you just go to the market and ask, what is the price for one more? And of course, that's also different if you ask, what is the price for one more of the least expensive type of food in each category? So I'm just curious what you think about that question of measuring access through the least expensive and measuring access through the market price in contrast to the average that people will report. Is that something you've thought about? You know, if so, what do you think of it as a question? But it's great work. It's really amazing. It's wonderful to see, and I'm very impressed and happy we can have this discussion here, especially with other Malawians on the phone, but also, you know, Andrea and others elsewhere. You know, very interesting to think about the differences between the contexts.
I don't know, Alex, how we are handling this. Should I answer, then go to
Yeah,
next?
please.
Or
We'll do one at a time, and then we'll go to Andrea and then anyone else. Yeah.
All right. So thank you, Prof, for that observation. Yes, I think they are different. They are different because on the market, it's all range of food. Well, in the households, as you said, it's average, and also the household preferences. So go into play, and also they have, you know, access to a wider maybe range of sources. So maybe in their local markets or supermarkets, or in the market, you really know what type of market you are dealing with. So these are really different. I didn't think how well we can analyze these two in this study, because still from the look of the things, we still have more of the household data than the market study. So whatever I'm presenting here, it's from the average prices, not really market prices, because even the market prices, the representation is very small. Yes. So yeah, it's a good point to think through as I'm continuing with the study, because this is just like the first stage where I'm trying to understand the topic and get into details and see what's the knowledge gap that is there that I can do specific analysis and so on. So this is another point to guide my research. Thank you for that.
Great. And Andrea?
Great. Yeah. Thanks, Joyce, for your presentation. There's a lot. I have a lot of methodological questions, so I look forward to the paper where I can dig into the details. But I'll just cherry pick a few. First, I was also curious about that household versus market surveys and what that means for the data, because the household surveys are presumably also recall as opposed to like collection of actual data, I'm assuming. So that would be interesting to get a bit, yeah, to get an answer to. And then also I'm curious in terms of having to, you mentioned that you had to convert everything to, you know, the standard unit of the price per kilocalorie. And I'm wondering how many of the studies did you have to do some additional conversion as opposed to the data was reported in terms of that indicator, the price per kilocalorie. And I'll just ask one more and then I'll just stop. But I'm also curious about the original. So for the underlying data, do you have any insights to what the original source of that data was? Like, is it national, like data that's collected by national statistics offices versus like smaller scale studies, and then what does that mean about representation, et cetera, et cetera. So I'll pause there, but any insights that you can give would be useful. And yeah, great job on the work. Thanks.
Thank you so much. Yeah, indeed, to start with the first on the conversion, if I'm to give a percentage, I think I did conversions on about 40% of the data set. But I can come back to you in details because that is like, it's in the DUFA, but now I cannot, but it's about 40%. The beauty is most of the papers, they gave the ranges in kgs, and also we're trying to apply to nutrition understanding. So they will do already the conversions in kilocalories. So most of the studies, some of the studies they already did the 100 kilocalories. Converted to kilocalories, I'll just narrow it to 100 kilocalories so that I don't have bigger values. I mean, very, very minute cost values. That's why I converted to 100 kilocalories. But about 40% of the data, I did these changes. But on the statistical and household data issues, on whether secondary data they used on household surveys, most of it is on the national IHS integrated household surveys that are available for most of the countries. So that's the national level data that they used. I don't remember any of them using small sample or limit specific region or country studies. They use national representative surveys. I
Great,
don't know if
thank
I've
you.
answered all of your questions. Yes, thank you.
Yeah, thank
Great. And I saw Innocent had a question in the chat, which you're welcome to turn off your microphone or turn on your microphone and ask, or I can just read it out for you. But I saw you had your camera on, so maybe you're able to speak.
Yes,
Was that
thank you
me?
very much.
No.
Yes, thank you very much for this nice presentation, Madam Joyce. So I was just curious because I came in late, but if you could say a thing, if you looked at the food and diet costs differently and reported them, and if how did you define health diets as you looked at the data from 10 different countries? Like, do you come up with one definition that you used and or maybe what can you shed light on that area too? Thank you.
Thank you. Sorry, can you come again on the first part of your question? I did get it clearly.
Okay, were the cost for health that for food items and that, because I think food and that are a little bit different when you say, you know, in maybe
Okay.
research and in actual practice. So how did you look at that in your study? Yeah.
Okay,
That's the
fine.
first
No,
part. Yeah.
now it's clear. Thank you, Innocent.
Yeah.
For me, I think the way we're doing this analysis, we looked at the food groups. So we define these as roughly as diets in our case, because we're looking at each and every food group that was available to do analysis on. So we refer to these as diets, and we know the way you are explaining. Yes, a diet it could be defined as a plate where you have all these food groups represented. So that whole plate, referring to it as a diet. But in this case, it was looking at the food groups themselves, not actual plate. So the Lancet recommendation diet I was referring to, that one looks at a full plate, and they have specification how much vegetable should go into the plate, how much carbohydrates, how much each and every food group to go into that plate. So this study was on the particular food groups. So we did further analysis to look into the papers that did a further analysis from the food groups to costing a diet. There were just very few. I think if I'm remembering well, there were just 2 of the 7 papers that managed to interpret the cost estimate from the food groups into a proper diet. So most of the diet that was costed was the global diet. The global diet was the one that they were trying to cost from the figures I got from the food groups. So for us, we couldn't do a diet costing as a diet, but we went into particular food groups, because from this food group, that's when we have a full plate that we are calling it diet. So a healthy diet in this case, we are looking at the food group that is able to provide dense or adequate I should say healthy, I should say dense nutrient food. Dense nutrient food group, that's what we are looking at. So for example, I kept on referring to vegetables, I kept on referring to animal source food as healthy diets or healthy plates, because in them there's dense nutrients in terms of micronutrients and even macronutrients as compared to starchy staples where you just get the energy. So that's how we defined it in this study. I hope I've managed to explain to you clearly, yes. But it's important, as I said, it's important observation. We need to make clear on how we define this, because further analysis on this, especially on the diets, has an implication on which diet we are referring to and how I'm defining, because there are a number of different diets outside there. So I need to come clear on how I'm defining my diet. Thank you, Innocent. I'll take that into consideration as I do further studies on the same.
Great, and Gizelle?
Yes, thank you. Just very interesting study. I mean, meta-study or meta-analysis. I actually was part of a study, a similar study. We did a market data collection for food prices in Tunisia. So that would be also in Africa, but not sub-Saharan Africa. The study is just published actually this year. And what we did was actually we did the pricing for food groups according to a specific food service. So for us, we used the dietary quality questionnaire, food groups to cost those food groups specifically. Now I understand that there are, fruits and their vegetables are divided up into different groups. So you have the leafy vegetables, you have the starchy vegetables, the roots. Was there any differentiation in these studies that you looked at in terms of, the starchy vegetables or the root vegetables, the leafy vegetables, the orange-colored vegetables and things like that? And I didn't see any fruits and the food groups that you mentioned. Also the fats, for example, I mean, in Tunisia, olive oil is very expensive versus other like soybean or corn-based oils that come, and they're much cheaper. Was it an average? Did that take into account the more expensive oils like the olive oil, or is it just not out of question in the sub-Saharan African countries? I don't know. So just wanted to see what was included.
No, it's good to learn about that study in Tunisia, and maybe if you can share the paper, so
Sure.
it would help get more insights into this topic. So yeah, thank you for that question. And I think, yes, maybe it did not appear because maybe it was published this year. My search was done in January, early this year. So even if it had popped out, I would have tempted to look through, because it's same Africa. So yeah, it would be nice to share with me to get some insights. So on the papers I looked into, depending on regarding the fruit and vegetables, there was no clear categorization. It was just named vegetables. So even in the analysis, it showed a very great variation. The cost is not, as you're explaining, it means it's not. It has a number of categories, as you say, leaf vegetables, starchy type vegetables. So the prices will not be the same. That's why the price itself had a lot of variation. And even when it came to trying to describe the factors affecting, influencing or describing the variation, wouldn't find any important. That means it was beyond the variables that I managed to bring on the table to explain the variation. So that could be true. But from the analysis that I have done on this, there was no such categorization. Yes. Thank you. But it should be there. From Malawi, on the market, you can have variety of vegetables and even fruits in different seasons. So the price cannot be without such a variation. So it could be similar to what you found in Tunisia. Thank you.
Great, and I see a question in the chat from Andrea, which is, what do you think the key barriers are for future food price studies? You mentioned at the end of your presentation that more work is needed in this area, but there's been a notable drop since 2014. So maybe if you could speak a little bit about that, and then if there are other people on the call working on food price related research, I'd love to hear your perspective on that too. But Joyce, we can go to you first.
Yes, so yes, I showed that we really wanted to do estimate the food to show the food cost estimates up to 2024, but data couldn't allow us. We didn't have any data collected after 2021. So the implication is clear there. Whatever the policy recommendations we are giving, they are not based on the current information or current circumstances. We are referring to audit data kind of, but I know through the food access programs, there are programs that national statistical offices, several of them in Africa, are now doing data collection. Myself, I managed to get some data from National Statistical Office, only some, I think, up to 2022. So since it's not publicly available, maybe that's why you don't see more peer-reviewed papers coming out from such data. So if you can open up that data to make it publicly available as it is with integrated household survey data, maybe that will also increase the literature developed around such topics. Yes, that's my take on your point, Alex.
Wonderful. And I can share a little bit about, what we've learned trying to get data from national governments for the Food Prices for Nutrition project, which I'll put the link in the chat below. But this project has developed a way to measure the cost of a healthy diet, as Will described earlier, using the least cost available foods in different food groups to determine what a full diet can be at the lowest cost, a full healthy diet. And this project has worked with national governments in Africa, notably Nigeria, Ghana, Malawi, Ethiopia, and some others, as well as in Pakistan. And what we've learned working with these national statistics offices is that it's very, very hard to get their data. It's often very closely kept, sort of almost like a national secret in some ways. They don't really want to share just with anybody. It's very sensitive data. And so, while it's been very helpful to have these national statistics offices start to publish bulletins and reports about the cost of a healthy diet using the method that you can read about on the website. That could also be one reason why in recent years there hasn't been as much academic work on this. While there has been like a ton, I just can't emphasize enough how much research about the method that you can read about on the website. But maybe for other aspects of this, there's been a little less activity. But I'm curious, like for the whole group, if people have perspectives or their own experiences about food price research. I know Andrea did her Amana Fellowship about this, but there may be others on the call. If you could just share a little bit about what that's looked like for you and what you want to do in the future, I think that'd be a kind of interesting way to close it out here.
Just a quick thing to add, Alex. So for me, my work, I'm based in Uganda, and my study was based in Uganda, and I went to the National Statistics office in order to get that data. So Uganda actually does a pretty good job of reporting. They do the monthly CPI reports. But another challenge there is that they report the data that is publicly reported is index level. It's not the raw data. And so I had to, make a explicit direct request to the director of UBOS in order to get access to the raw data. And then a lot of the information that you need in order to really understand what food items they have priced, even that information is really hard to get, or it's just really not clear, like when they say, anyway, so that's supporting data that is really essential for understanding and calculating prices in the way that we might want to. It's really murky. So yeah, I'm also curious about others' experiences, but that issue of reporting in terms of index and not the raw data and having to like make special requests for it is yeah, a big deal. Thanks.
Yeah, definitely. Are there other folks who, have ideas or opinions about this? I'm curious. And if not, that's okay too. It's a big question. But maybe Joyce, maybe if you could share a little bit about like what you want to do in the future, like what's next after this study. Like I assume you're going to try to get this published or do something else with it.
Okay, thank you, Alex. So yes, as I said, this is part of my academic work. It's one of the initial outputs when I was trying to get to know more about the topic and found those interesting guidance. And I think it also made me think through the type of data that I'm anticipating to get. And likely, as I said, I've managed to get data from NSO through the help of Tufts University, of course. So the next thing would be so and also this study, the research output is under review for peer, is under the review in a journal, peer review journal. So if all goes well, it will be out and it will be shared on the same community of practice. And also the next step will be now going to the affordability issue. Looking at basically, I will zero in Malawi, but I will look into those factors that would really provide insights onto the regional and national and subnational issues that would really influence affordability issues in Malawi. So that's the next step, depending on the data that I've managed to acquire from the National Statistical Office. So I also look into the broad aspect using the computable general equilibrium to see how the changes in the macroeconomic changes will really influence the access to healthy diets in Malawi. So it's kind of broad at the moment, but we are moving on, getting to know more of the topic and willing to do more work around the accessibility, economic access to healthy diets. So that's what I can say in a nutshell. So once we have tangible results, tangible evidence, will be coming back to share with the community, because this group is really important and really helps in shaping the research. Thank you so much, everyone, for giving in your comments, showing up. Let's keep in touch. Yes, over to you, Alex.
Thanks, Joyce. Thank you. Yeah, thank you all for being here. I learned a lot. It was a super interesting conversation today. I think we can close it out. And just a reminder that when the Zoom ends, there'll be a little pop-up for feedback. If there are things we could do differently about this community or things you'd want to see that could be new, let us know. And you can reach us at that email I shared before that's on our website, researchcommunities@tufts.edu. If you want to share your work or share anything in general with myself, Noah, and the team. So thank you all so much. Have a great rest of your day, and I hope to see you at the next event. Take care.
Thank you.